From the News Channel 5 Network, this is OpenLine.
Well, good evening on this chilly December evening. I'm Chuck Long here with you for the next hour. It is Open Line, and we have a really great show lined up for you. Three great guests are going to be talking to you about senior care. And I know a lot of people out there, as you're watching, you're going to have questions. Well, that's what Open Line is all about. It is your forum. It's here for you to give us a call. 737-7587 is the number. And as the holidays approach, they're really right here upon us. A lot of really good things to think about when it comes to senior care, how you take care of the elderly, and some other topics that we'll get into as well that surround care at home. Now, our guest tonight, we're welcoming back Josh Smithson, owner of Seniors Plus More. Great to see you, Josh. We also have Beverly Headley, registered nurse, owner of Nashville Care Managers. Good to see you again. And we're welcoming to the show, and good to see you, Dr. Wallstedt, founder of Blue Sky House Calls. You are a doctor, and you do actually make house calls. So I've got a great panel here, but before we get into a lot of the questions, and as people start kind of jotting down some questions, comments that you guys may have this evening, I want to kind of give everybody an overview of what it is, Josh, that you guys do with Seniors Plus More, so that people just tuning in for the first time can know what it is that you do.
Well, Seniors Plus More is a non-medical in-home care service. We cover all of Middle Tennessee. We help people stay in the homes as long as possible, and we also help people in nursing homes, assisted livings, and stay in their comfort of their own home.
Oh, well, so that's great to know. So you can also go into the nursing homes and assisted living homes, not just in their homes.
That's correct.
Very good to know. All right. Beverly Headley, registered nurse, Nashville Care Managers.
Yes.
Great to see you again. Tell us about that.
Well, Nashville Care Managers is a company owned and operated by 3 RNs, and so we have a lot of medical impact, but we do assessments for people wherever they are, in their home, in the hospital, long-term care, assisted living, and try to help them achieve the quality of life that they want to achieve. We do that by helping them navigate the healthcare system. We do, coordinate doctor's appointments for them, interact a lot with home care agencies, such as Josh's, so that people can have that in-home care. We work with Dr. Wallstedt and his group in that we have he and nurse practitioners come in to the home so families can receive medical care at home. So we're the big navigator coordinators.
And it's great because even as we can tell in the conversation, you work in tandem with Dr. Wallstedt, you work in tandem with Josh. I mean, this is really a great thing, and I think it reassures people when they have the questions that there are places that they can go, there are people that they can talk to for these topics.
Absolutely. We're here for them.
Yeah, absolutely. So Dr. Wallstedt, founder of Blue Sky House Calls. Like I said, you are a doctor. Tell us a little bit about Blue Sky House Calls.
Sure. About 8 years ago, I was going, golly, this is really tough. My patients have a tough time getting in, finding parking places, finding their way around. It's really difficult to get in and out of the buildings, down these long hallways. And I said, something's got to change. We need to start providing care for these guys. We need to reach out to where they are. And so we just started bringing the doctor's visits to them. It's just like the good old days. I call it back to the future. So we're able to provide an amazing amount of medical care in the home. We can come see you, evaluate you, examine you, do minor procedures, write your prescriptions. We can get x-rays and ultrasounds and stress tests. I mean, it's just amazing the things we can accomplish in the home these days because of technology.
Well, and have people been surprised that there is a service where a doctor does actually make a house call?
Most folks are fairly amazed, but it doesn't take too long for them to get used to it.
Oh, I bet. Yeah, exactly.
They sure like it.
Yeah, absolutely. So many things to talk about. And again, whether or not it's an elderly parent, relative, friend, with the holidays approaching, I know a lot of times you're going to have big gatherings. You may be visiting these friends, the family, relatives, things like that. When you go into their homes, there's also things that you can look for to make sure that your parents or your relatives or your friends are getting the care that they need. Let's talk a little bit about this too. Really, Josh, what is home care? I mean, just for the uninitiated.
Well, we're a non-medical in home care, and then there's also home health, which, I think Beverly would be able to talk more about actual home health. But Seniors Plus More is a non-medical in home care service. So all of our staff are non-medical people.
And what are the services that you do when you go into the home or the assisted living facility or the nursing home?
We can provide companionship, meal preparation, bathing, dressing, anything to help with their everyday living.
Well, and do you find that people really have the need for that, and once you get into the home that you really become a friend to them?
Absolutely.
So tell me a little bit about when you first go in, kind of what's the process?
Well, when we first go in, usually people are scared and they don't want somebody new coming into their home, but then once we get there, they don't want the caregiver to leave.
Right. Kind of what's your approach just when you go and visit with people to reassure them, to make them feel comfortable?
Well, we always like to bring the caregiver out to introduce them to the client first, and the client gets to meet the caregiver before that caregiver actually shows up to work. And so that makes them a little bit more comfortable.
And how does someone find you guys?
Well, they go through the nursing homes, assisted livings, discharge planners, people like Beverly, people like Dr. Wallstedt, and that's usually how they find us.
And as far as contacting you, Seniors Plus More, how do they get in contact with you?
They can give us a call at 615-320-5707, and then we can set up an assessment and come out and find out what their needs are.
Okay, and if you didn't get that, don't worry, folks. We are going to have all that information for you during the show, so we will kind of be repeating that to make sure in case you did miss that. So, Beverly, as far as home care for you, what does that entail?
Well, we go in and do an assessment, and we especially work with people who are having difficulty staying at home. Maybe they've had multiple emergency room visits, and we go in and try to stabilize that situation. We evaluate it, make recommendations about whether we look at everything from medications to their environment, how we can make their environment safer, how we can help evaluate those medicines and give that feedback to their primary physician. Sometimes people are taking the same medication. They don't realize it's a generic name for the brand name. So we have do that. We do also exams, just questions to learn what their mental status is, because in our era, since dementia is a growing concern for people especially over 80, 85, we look at that. We help the families identify a plan of care, and then we help them implement that plan of care, which may include services such as in-home caregivers, such as Josh's people. It may be bringing in a physician who can see them at home, because getting out is a difficulty, and eliminating some of those ER visits when they don't necessarily need to be in the ER, because that's detrimental to a lot of our older people. That's a trauma to them to have to go to the ER or into the hospital. So we try to reduce those things.
Which that is a great help.
Yes.
Absolutely. Now, Josh, for example, when you guys kind of set up, I'm sure every person is different, every plan is different, but on average, would you say there are certain amounts of times that you go into the homes during the week? Kind of how does that work?
Well, we usually, once we set up the care plan, we usually make at least go in the homes once a week and kind of monitor and meet with the family, or we give the family a telephone call to see how things are going. So we're in constant contact with our families.
And, because I know even my dad, he has someone who comes to his home once a week, everything from fixing lunch to taking care of things around the house, to running some errands. Is this part of what you do too?
Yes, so we do all of that, and but from the management standpoint, someone would definitely come in and check out and make sure everybody's happy.
Okay, well, we're going to go to the phones right now. Right now, Fanny is on the line with us. Fanny, good evening. We're glad that you tuned in to OpenLine. Do you have a question or a comment? I believe you have one for Josh.
Yes, I have one for Josh.
Okay. Go ahead.
I wanted to ask Josh about these cell phones that they bring in the house. When they're supposed to be working and they don't work, they just stay on the cell phone all the time. They work about 2 hours and they're supposed to be working 8 hours.
So how do you handle that situation, Josh?
Well, we constantly try to tell them not to stay on their cell phones, and so we always ask for our families to give us that feedback so that we can address that issue.
Well, my family is trying to get something done, and I even called my insurance company today about it because that ain't right.
Right, so that would be a different company that you're referring to, but basically, Josh, what you're saying is that's one of the things that you talk to your people about and you say, that's one of the things that you absolutely discourage.
Absolutely.
Yeah, so that's why, again, I'm glad that you called. I think, a lot of times it's good to know someone who's referred by doctors, referred by registered nurses like Josh. So we can give you that information a little bit later on in the show, too.
Okay.
Okay. All right, well, thanks so much for calling in this evening.
Thank you, honey.
You bet. Thank you. All right, a lot of you getting ready to call in, actually on the line with us. We are going to have to take a short break right now. We'll take a break. Stay on the line with us. When we come back, more on senior care right after this.